this session on the topic which I shared earlier. But before he start, sir, I would like to direct few questions to you. I received online. I'm sure you will cover all these questions. First question is, sir, a patient with just undergone angioplasty, what extra precaution he needs to take care? And is it recommended for the patient with a cardiac or diabetic problem to regularly undergo the COVID test to make early diagnosis so that it can be prevented? Second question is Dr. Praveen Pawal. I'm a diabetic person living with family in Myanmar. So my question is that what extra care do I need to take care to protect my family and myself in this pandemic? What is the food to improve the immunity? What special care smokers need to take during this pandemic? What is suggested diet to improve the immunity? For any cardiac and diabetic emergency, do I need to do the COVID test first and then get hospitalized, or will the doctor keep me on hold till my COVID report comes positive or negative for the treatment? What are the basic medicines I need to take care, like vitamin C, D, zinc, or anything you suggest for us? And what basic things should I keep it with me for an emergency during the COVID? So these are the 8 questions I received for you, as well as some questions will be there in the live box. We'll direct you once we are done with that one. So over to you, sir. Now the audience is ready for your lecture.
Thank you, Dashrath, for the nice introduction. So I will start my topic of today's discussion. Hope my screen is visible, Dashrath.
Yes, it's visible to me now.
So good evening, everybody. Namaste. I'm Dr. Praveen, cardiologist, working at the Siloam Hospital from last 3 years. So today we are going to discuss about the coexisting with the COVID-19, and mainly the points will be what precautions should be taken during the second waves, how to improve the immunity, and how to take care of the people with the diabetic, cardiac and the underlying conditions. मैं थोड़ा बहुत हिंदी में भी बात करूंगा ताकि आई होप इंडियन कम्युनिटी है तो सबको हिंदी ज़्यादा कंफर्टेबल रहेगा, बट इंटरमिटेंटली सम इंग्लिश सम हिंदी. ओके, आज का डाटा टुडे अपडेटेड, it is not it's 2 days back, but today we have 5,400 cases of the COVID confirmed with the 96 death all around the Yangon. So situation in the Myanmar, currently local transmission was increased during the April and May due to the big cluster in Yangon. After the religious cluster, the imported cases were mainly detected, but from the August we are getting the many cases raised in the Rakhine state, and now the hot center, we all know that it is Yangon and Rakhine. So I will just go to the brief history. Everybody know about the COVID, and actually we are overburdened with the knowledge of the COVID, and I am here today to clear your myths. मतलब इतना knowledge आ चुका है कि हमको क्या सही है और क्या गलत है कुछ नहीं पता. तो थोड़ा बेसिक में है कि it is a SARS-CoV-2 COVID-19 virus, okay, basically known as COVID-19 virus. तो usually कैसा इसका presentation रहता है? तो most of the cases nowadays are asymptomatic. उनमें कोई भी symptoms नहीं रहता है. So therefore they are major transmitting the disease. तो दूसरे जो हमारे कोविड के सिम्टम्स है, दे आर फीवर है, ड्राई कफ है, एग्जॉशन है, पूरा वीकनेस आ जाता है बॉडी में, एंड देन इट स्टार्ट विद द शॉर्टनेस ऑफ ब्रेथ, धाप लगना शुरू हो जाता है. उसके साथ कभी कभी सोर थ्रोट होता है, हेडेक होता है, मसल थ्रोट. उसमें सर्दी नहीं रहती है, ज्यादा लोगों को सर्दी नहीं होती है, बाकी ये सिम्टम्स बहुत ज्यादा आते हैं. फीवर इज द मोस्ट कॉमन सिम्टम्स, और 5% लोगों में लॉस ऑफ टेस्ट एंड लॉस ऑफ स्मेल, ये भी बहुत कॉमन सिम्टम्स. दूसरी चीज है कैसा रहता है ऑनसेट. ये जो बीमारी है एक्सपोजर के 6 दिन बाद या 5 दिन बाद चालू होती है. इट स्टार्ट आफ्टर द 5 to 6 days, और 7 days के बाद सिम्टम्स आ जाते हैं. वो आपको माइल्ड फॉर्म में रह सकते हैं, बुखार भी हो सकता है, सर्दी खांसी भी हो सकती है. और 9-10 days it started with the shortness of breath. Shortness of breath is a major concern. इस वक्त हमको थोड़ा सा कॉन्शियस होना चाहिए. और ये ARD अगर इस समय से आप निकल गए 7 से 10 दिन तक, देन वी कैन गो इन द रिकवरी फेज. अगर 9वें-10वें दिन आपको अगर ARDS हो गया, देन इट प्रोग्रेसेस टू द वर्सन. तो अगर माइल्ड केस है तो 2 हफ्ते के अंदर ठीक हो जाओगे, अगर सीवियर केस है तो इट विल टेक अराउंड 3 to 6 weeks, okay, including the time of onset. तो अभी ट्रांसमिशन, ये हमको सबको पता है कि एरोसोल से ट्रांसमिट होता है, क्योंकि सामने जब आदमी बात करता है, when he coughs or he talk to you, the things are spread with the aerosol. और दूसरा जो रूट है एरोसोल, मतलब अभी खांसी हो गया तो उसके बाद थोड़ी देर तक ये हवा में रहता है. दैट मीन्स अगर कोई आदमी कोविड सस्पेक्ट है, वहां से चला भी गया, then also the droplets are held into the atmosphere. So that is the reason why the mask are helpful. ये aerosol से जो हवा में तरंगते हैं, तो that is one of the thing we need to take care during this season. तो प्रिवेंशन के लिए आप क्या करना चाहोगे? तो हमको ये सब पता है, 3 basic things are there. एक है हैंड वॉशिंग, दूसरा है मास्क, और तीसरा है सोशल डिस्टेंसिंग. These are the 3 golden words you need to follow during this period. कोई भी कितना भी बोले तो दिस शुड बी फॉलो. क्योंकि मास्क पहनना क्यों जरूरी है? क्योंकि जो एरोसोल स्प्रेड है, हम कहेंगे कि नहीं मैं बाहर जा रहा हूँ, खुले में जा रहा हूँ, आई एम जस्ट गोइंग टू द मॉल, वहां पे कोविड नहीं मिलेगा. नहीं, वहां पे आके भी गया तो भी एरोसोल में रहेगा. सो इट्स मास्क इज अटमोस्ट इम्पॉर्टेंट. सो अभी मैं बाहर जा रहा हूँ, ट्रैवल करूँ या नहीं करूँ, अगर आपको सिम्टम्स है, ठीक है, आपको सादा सर्दी खोखला है, तो फिर भी यू शुड बी वरीड that आपका immunity कम रहेगा, तो you are more prone to get more infections. And if you have the COVID, and you are also spreading the more infections. So if you are sick, stay at home, don't come out. Okay, so while traveling, please avoid the cone contacts and frequent hand washing and eye touching. अभी दूसरी बात है वर्क प्लेस में प्रिवेंशन में क्या करोगे? तो वर्क प्लेस में क्राउडेड प्लेसेस अवॉइड करिए, क्लोज कॉन्टैक्ट सिटिंग अवॉइड करिए, है ना. कन्फाइंड एंड एनक्लोज स्पेसेस विद द पोर वेंटिलेशंस आर मोर रिस्पॉन्सिबल, क्योंकि उसमें डेंसिटी ज्यादा है एंड द वायरस एक्सपोजर इज मोर. तो ऑलवेज एंश्योर द गुड वेंटिलेशंस, खिड़की ओपन होनी चाहिए. डोंट रिमूव द मास्क इवन इफ यू आर टॉकिंग टू द क्लोज फ्रेंड्स, यू हैव हाई चांसेस टू गेट इन्फेक्ट फ्रॉम देम. मीटिंग विद आउटसाइड पर्सन शुड बी लिमिटेड टू 15 minutes, उससे ज्यादा मत करिए, क्योंकि जितना आप एक्सपोजर टाइम बढ़ाओगे, the more you are prone for the exposure timing. So these are some ethics, because most of you are going to the office, so these are not new. I am repeating because you need to follow these things. फिजिकल एक्टिविटी के बारे में बहुत लोगों को कंफ्यूजन है कि मैं एक्सरसाइज करना चाहिए नहीं करना चाहिए. यस, यू शुड हैव एक्सरसाइज एट ऑल एजेस. अगर कोई ओल्ड एज है, उन्होंने भी एक्सरसाइज करना चाहिए. एटलीस्ट शॉर्ट ब्रेक, 3 hours 3 to 5 minutes you should go and walk, at least movement, stretching, other things. Regular physical activity should also be encouraged. जैसे यंग लोग है, उन्होंने 30 minutes daily या 1 hour, at least 150 minutes a week करो, है ना. योगा प्राणायाम करो, ब्रीदिंग एक्सरसाइज करो. why this is important? because लॉकडाउन में you are sitting and watching the TV. it may lead to the clots in the lower limbs also, and this also makes your lungs very poor. So at least you should stretch your body and exercise regularly. Now the questions comes to immunity booster during the COVID. क्या करना चाहिए हमने immunity boost करने के? बहुत important है एक्सरसाइज का करें. जैसे मैंने बताया, you should have at least 150 minute exercise. अगर आप old age है तो थोड़ा 15-20 मिनट करिए, मगर करिए. You should be stretching करिए, योगा करिए, प्राणायाम करिए, एक्टिविटी में रखिए. Sleep is very important. Sleep at least 8 hours तो भी होनी चाहिए. It's recovers your body, very important. 8 to 9 hours. Therefore, I discourage to reduce your screen timing. इसलिए बहुत सारे कोविड सेंटर्स में मोबाइल निकाल दिए, क्योंकि we cannot relax by watching into mobile. Our mind and brain is continuously running. We want silent brain, silent mind, so that we can have a good immunity. Now, role of vitamin D and vitamin C. Yes, they are not proven to be beneficial, but at least they are preserving your immunity, so you can take vitamin D and vitamin C medications. Also, along with that, you can take for the zinc supplement. So these three medicines I recommend, because you are not going outside to get sun exposure, so you need to fulfill this vitamin deficiency. Steam inhalation, water not proven to be useful, but ले सकते हैं. इसमें डाइट का बहुत इंपॉर्टेंट है ना. जो डाइट खा रहे हैं, मतलब वेजिटेरियन खाइए, फ्रूट्स खाइए, है ना. जो भी, अगर इफ यू आर ईटिंग नॉन वेज, उसको अच्छा पका के खाइए, है ना. इट शुड नॉट बी रॉ मटेरियल्स आर नॉट सो गुड. अब ये तो आपको मैंने बेसिक प्रिकॉशंस बता दिए. आई विल गो टू सम मिथ बस्टर्स. मिथ बस्टर्स में जो आपके कुछ लोग बोलते हैं, सुनते हैं, है ना, सोशल मीडिया पे बहुत चलता है ना, मजाक में भी होता है, but we can take it seriously. So use of alcohol is very harmful to the body during this period. बीच में we had studied that hydroxychloroquine prophylaxis was recommended or not. I suggest not to take the hydroxychloroquine, but now the trials had shown it is not indicated in the patients and not prophylactically it is useful. ये बहुत हमने एक्सरसाइज करने के वक्त मास्क पहनना चाहिए, नहीं पहनना चाहिए. तो एक्सरसाइज करते वक्त सोशल डिस्टेंसिंग का ध्यान रखिए, बट यू शुड नॉट वेयर द मास्क व्हेन यू आर एक्सरसाइजिंग. इट मे reduce your ability to breathe comfortably. Okay, and sweat can make the mask wet and more quickly, which makes difficult to breathe and promotes the microorganisms, and you can get multiple infection. So important, at least maintain the physical distancing while you are walking. अगर जूतों से with the shoes you can spread the virus or not? Yes, with the shoes you can spread the virus. You understand? So but very limited, मतलब जब बच्चे को शूज के पास जाएंगे तभी हो सकता है, otherwise it will not be there. So at least be safe from that thing. Okay, and keep your shoes outside. Okay, COVID-19 will बैक्टीरिया है नहीं, it is a virus. Okay, तो एंटीबायोटिक लेने से आपको कोई उसका फायदा नहीं होगा, तो just remove the myth that you should not take antibiotic during that. Okay, so most common symptoms are cough, dry cough, tiredness, and fever. Okay, some development that is the repetition. तो हम young है, हमको होगा नहीं, ऐसा है. It's not like that. Everybody is equally susceptible for the COVID. So everyone should take the precautions, even young ones, because you are the most common people to spread the virus. You will not become unhealthy, but you will make others unhealthy. So are the specific medications to prevent COVID? नहीं, ऐसा कोई भी दवाई अभी तक नहीं आया that can prevent the COVID. So please don't go anywhere that this is a COVID prevention and other things. So there is no such medications. And so mask. So I recommend you to at least use the 3-ply mask, which is at least 80 to 85% protection for you from the COVID. See, the cloth mask gives a 50% and the sponge mask gives the only 20-30%. So I recommend always try to use the 3-ply mask. They are now cheaply available in Yangon. N95 is the best, but it is mainly for the medical professional who are working in the area where their risk of exposure is very high. Okay, so it's not a 3-ply mask, means there are really 3 layers. We cannot see, but there are three layers really. And this N95 has a special shield which has 4 layers. So now we are going for the risk of the COVID-19. So you can see up to the age of 59, the mortality is below 60 is hardly 1.3%. But as the age increases, the mortality increases 3.6%, 70 to 88%, and then it goes to around 20%. So old age persons are more susceptible for that. Now we go with the comorbidities. As Dashrath asked us that how the diabetes and hypertension patients should take the precautions. So the diabetes patients are more susceptible because their mortality as compared to the general public is 7.3% high. And for the cardiovascular, it is 10.5%. So the cardiac patients and diabetes patients are more susceptible for this. Okay, so they are specific for the heart attack patients. So in the heart patients, we have mainly the hypertension, heart failure, heart attack. So the patients who have the high risk of mortality and morbidity, so the patient's hypertension should be well controlled. So these patients should well control their hypertension. I advise not to stop the medicines. Myth is that they are taking the AS and ARBs, losartan, they should discontinue. No, they should take it. You should continue the same medication, don't change the medication. Exercise and low diet is the key to that. And about the heart failure patients, they are also have the multiple comorbid conditions. So I advise not to discontinue the medications, take all the precautions as advised. Also try to have a less contact with the young persons at the home. Because you said, I am not going home, I am old, I am staying home. But your young people are going home and they are exposure. When they come from the outside, they should change their clothes, wash their hands, and then only they should come. And they should minimize the contact with the old person as much as possible. you should be vaccinated for the seasonal flus. Okay, there is no vaccine for the COVIDs, but those who are susceptible people can vaccinate for the seasonal flus. You can take the bed rest and do the moderate to exercise, as I told you. So this is just a graphical representations how they are presenting of the heart failure. Now the COVID patient also can have the heart attack. So these are the varied manifestation. COVID does not only present what I described, it can present in any other ways. Okay, so these are just background of the COVID I give. About the heart attack, I just want you people to know that if some people are scared to come to hospital even after the major illness, but the patient who are having the chest pain, which is central squeezing in nature, do not hesitate to come to the hospital. We have the special protocols in the emergency to treat these heart attack patients. So COVID-19 and diabetes. So is this diabetes patients have the risk of around 7.3 risk. The risk is more when your diabetes is not controlled. जब आपका diabetes बहुत ज़्यादा है तो you are more prone. So मैं आपको advise करूँगा अगर control नहीं है तो control कर लीजिए. You can adjust by the diet or you can consult your doctor and get the diabetes control. Okay. So this is a good time to get into the shape and all the things. Now एक नया है मगर it is a very dangerous risk factor and that is obesity. Being obese doubles the risk of the COVID-19. So rather than others, it is, and the dying risk nearly doubles up to the 50%. And also the hospital admission is 74% in the obese patient. So obese patient should be extra precautions. Okay. Obesity, it doesn't calculate. It starts from the 30 to 80. So these people are most of the time risk because their immunity is impaired. And because of the obesity, their lung functions are also reduced. So with the mild infection also, they can get severe respiratory distress. So this is very important thing. Because of the metabolic dysfunction, immune impairment, and adipose inflammation. This is. So as now this is my total topic. So now I will go to the Dasharat questions what he had asked me. I will conclude within 5 minutes by answering these questions, and later you can answer me the more questions. So the patient who had just gone under angioplasty and extra precautions need to take in this situation, it is advisable for the frequent testing of the COVID. No, this patient should stay home, but do not discontinue. If you have done the angioplasty, you should take the antiplatelets, which are recommended by the doctor, at least for the 1 year after the stent. You should continue the medication. Do not discontinue the medications. If you are not able to come to hospital, you can do the teleconsultation and follow up us on the online consultation. And no need to check frequently for the COVID. If you have symptoms, then only check. Or if you have exposure, then only check. For the diabetic person, I had explained you the risk factor. You should control the diabetes. Food, you should take the proper vegetable. Avoid the cold things. Take the warm things like cold drinks and all the things should be avoided. Ice creams and all, which are more prone for the respiratory tract infections. Okay, so try to get the healthy diet and boiled diet. So for the immunity, I recommend you to take the vitamin D and vitamin C because sometimes you are lacking. You can take that supplementation. For the smokers, they had already the damaged lungs, so they are more prone for the infections. One thing, because they are frequently touching the lips when they are smoking, so the hand touch, and that is also is very risky, and they should avoid the smoking during this situation. And I told already for the diabetics, basic medications, what should you keep at home during the emergency? I recommend at least keep some paracetamol tablets, cetirizine tablets, one or few antibiotics if you are not accessible, like amoxiclav or clavum, you can keep. Also keep some pantocid tablet for the acid reflux, and some immune boosters like multivitamins. Okay, and you can keep some Vicks and other things, inhalers, and some cough suppressants like Ascoril or something you can keep at your home. So at least some measures like paracetamol, cetirizine should be there at your home so that you can at least take basic care of you. And I once again recommend you to keep the pulse oximeter if you can buy. So that will help you in future. It's not, we are not in that condition, but it will help you to monitor your oxygen saturation. One more question was there, whether that if your breathing time, if I hold the breath for 20 seconds and other things, is it COVID or not? See, that tests are not valid and viable because it can be happen in other lung diseases or heart diseases. People cannot hold. And don't get into that myth. If I cannot hold that breath, I am suffering from the COVID. So don't go into that myth. So that test is not valid. So that is not useful. You can just check the oxygen saturation. That is useful. Okay. So this is what I want to tell you. So with this, I am concluding my topic. So if any questions, Dashrath, you can ask me.
Yes, sir. I got quite a few questions for you, but I think better we can discuss that question at the end.
Yeah,
With
that will
like
be a good idea.
together.
Yeah,
Yeah,
yeah.
many
So
people
I
have asked
invite
the question. Many
Dr.
people have
Thiri.
put their comments on Facebook Live. I've noted these questions. Once we are done with all the three speakers, we'll go with the question answer session.
Sure,
Uh,
sure, sure. Okay, I will ask Thiri to do.
Okay. So friends, I think you must be having many questions. You can keep on posting the questions in the comment box. We will pass on to the speaker once we're done with the all three session. Dr. Praveen, thank you so much for informative session. Basically, क्या होता है ना कि कोई पहचान का एक known face is there on the other side, so it boosts our morale very high. So that was a highlight for the session. Hello.
Thank you, Dashrath. So I want to tell you that you should just be conscious that and be active, but not so much fearful about the COVID. Okay, just take the basic precautions. But precautions are must. That's what message I want to convey. So let's move on to Thiri.
Okay, thank you so much. Now I would like to introduce our next speaker, Dr. Thiri Aung. She is a general manager with Hlaing Siloam Group of Hospital. She is a Burmese citizen by birth. Dr. Thiri is a medical doctor who got her bachelor's degree, that is MBBS, in the year 2016. With ambitions to become a healthcare leader, she then pursued her master's in business administration in the healthcare management from De Montfort University, United Kingdom. Having received a distinction in her MBA, she was motivated to further undertake a master course in a cancer awareness and prevention program from the Union of International Cancer Control. In the year 2020, Dr. Thiri successfully completed the Southeast Asia Healthcare Leadership Program from the Harvard Medical School. In past 4 years at Panline Hospital, one of the leading private hospitals in Myanmar, Dr. Thiri rose from intern to the general manager, head of the operation of flagship hospital, where she manages more than 500 employees. With the health awareness project that she led and played an integral part, namely You Can Breast Health Club, to promote the breast cancer awareness and early detection. The hospital has achieved the Health Promotion Initiative of the Year award at the Healthcare Asia Award 2019. During her professional journey, Thiri has played an integral role in a vast variety of initiatives, including achievement of a Joint Commission International (JCI) accreditation and implementation of an integrated electronic medical record, that is EMR, both of which are the first time in Myanmar. We are really lucky to have such a knowledgeable, well-known and qualified person as a speaker for our next topic. Dr. Thiri, before you start, I have some questions for you, and I'll just briefly uh, put some questions to you which we received from the Google form. Most of the questions are related to the protocols, guidelines, hospitalization of the patients in Myanmar for foreigners as well as locals. So when to do the COVID test? Are there private hospitals who are treating the COVID in Myanmar? What are the warning signs? For expat, what basic medicines like common antibiotic or cold or viral flu we should take in case of common symptoms? Someone say that corona can be detected even without symptoms. So how to confirm that one I got COVID disease? Where are the fever clinics? What is their role? If I get any fever before approaching any doctor, should I go to the fever clinic or should I directly go to the hospital? Doing the test, where I'll be quarantined? What is a hospitalization duration for if any expat get infected? Let's say I'm an Indian. If I get infected, Does Myanmar government have a separate facility for the expats? And most of the questions are of similar nature. So ma'am, over to you. You can just quickly go through your presentation, and people are eagerly waiting for your session. Over to you, Dr. Thiri.
Can you hear me?
Yes, I can hear you
Thank
now.
you, Mr. Dashrath, and for your kind introduction. And since you have sent me the questions beforehand, it's very helpful and helped me to prepare beforehand about the questions that you have asked. And then I believe I have covered the questions in my presentations. And firstly, good evening, members of Morya. I hope you are staying strong and safe in this difficult situation. So since we have been in this COVID pandemic for almost 10 months, since December 2019 globally, and in Myanmar since 23rd of March, it has been impacting, it has been proven to impact more than just our health. It has been impacting how we live normally, how we eat, how we shop, how we walk, and even how we interact with our loved ones. So until we find a vaccine or a treatment, the best way we can do it, we might as well cope and coexist with it, and then we have to live with it. So this is just a global snapshot of what's happening around globally and in our country. So and globally, you can see that we have 4,000 cases per million population, 124 deaths per million population with a case fatality rate of 3.1%. In our country, Myanmar, we have been doing quite well until we find a locally transmitted case in Rakhine Sitwe on 16th of August. Starting from that time, we have seen a spike in our daily cases, and we are now at almost 6,000 cases. It has been very surprising that last month, on 21st of August, we are only over 400 cases, and this month, on the same date, we're almost 6,000 cases. So the best thing we can do at a personal level for us is to stay safe, self-isolate, and try to cope with it so that we don't strain our healthcare system, workforces, and resources. So this is just the common symptoms of COVID-19, which Dr. Praveen has explained before, so I won't go over it, but these symptoms usually appear 2 to 14 days after exposure, and then we need to take actions when we notice these symptoms. So going on to the next slide, before I go on to what how to deal with when we see the symptoms, I just want to share the spectrum of the diseases. So based on various studies and findings across different countries, it is seen that 40 to 60% of the patients are asymptomatic, and 20 to 40% of patients have mild symptoms where we only need home isolations. Only 15% of cases have moderate to severe signs and symptoms where we need hospital care, and only 5% have critical symptoms where we need the intensive care. So the key message I want to give here is that we don't need to panic when we find a symptom. We just need to assess and look out for a healthcare provider, and then we need to stay at home is the best option. So when to seek care? So the best option at this stage is if you're worried but well, stay at home. And as Dr. Praveen has mentioned before, boost your immune system by drinking plenty of fluids, have plenty of rest and sleep, and protect yourself by cleaning your hands often and avoid close contact. However, if you're sick and think you have been exposed to COVID-19, call your healthcare provider for advice first, because your healthcare provider can better assess if you're sick on your signs and symptoms. And if you think you have a contact with a positive case, healthcare providers can better evaluate whether you are low risk or a high risk contact. So as I mentioned before, 80% of the cases are asymptomatic and only have mild symptoms. So if you're under 60 without underlying health condition, it is better to self-monitor, self-isolate, and stay home until you're well. Because if you go and visit to a hospital, a dedicated COVID hospital at this situation, you might not even get enough attention, and you're increasing your chance of getting exposure. But then if you think you're very sick and have a health emergency, like breathing difficulty, pain in the chest, blue lips and face, and if you have confusion or difficulty to get awake, please seek immediate medical attention. So this is just the definition of contact person, which MOHS has posted on their website. So the main thing I would like to reinforce here is the contact person means if you have face-to-face contact with a COVID-19 case within 1 meter for more than 15 minutes, or if you have close physical contact with them, or if you are in a closed room for a long time with them, it has high exposure. So if you're face-to-face contact at less than 15 minutes, or if you're in a closed environment but less than 15 minutes, this is low exposure. So it is very important that you stay separate, isolate from other people at your home, at your work, and then take personal responsibility. So these are the different testing methods currently available across the world: antigen-based immunoassay, antibody-based immunoassay, and real-time PCR. Currently in our country, we're only doing real-time PCR, which is done by MOHS. So normally this testing is only takes 6 hours, but then for the swab taking time to the result reporting time, it usually take around 24 to 48 hours. So who get tested currently? So patients under investigations, which means patient who gets admitted to the hospital with signs and symptoms, primary contact with positive case, and returnees from overseas, and those from stay-home areas who travel to other areas, these people get tested now. So these are the different quarantine protocols we are currently practicing in our country. So swab test positive cases are usually taken care in the hospital only, and primary contact with positive cases, overseas returnees, and returnees from stay-at-home areas are currently taken under facility quarantine. But then those who are 2 times swab negative in primary contact with positive cases, after that they do the swab test 2 times, and if they're negative, they're allowed to take home quarantine. But for those returnees from overseas and those returnees from stay-at-home area, they are at the facility quarantine, and after they take 1 time swab, they are allowed to, if the swab is negative, they are allowed to do the home quarantine for 7 days. So another thing I would like to just strongly remind you here is not to ignore your non-COVID morbidity and mortality during COVID. Various studies have shown across different countries that COVID has hastened the deaths of non-COVID diseases, because due to the resource allocation of the health workforce and the resources in COVID treatment, there has been significant impact on the non-COVID preventions and treatment guideline, treatment in different countries. So it is important that you take care of yourself, notice your own symptoms, and then take the treatment regularly. Because just because COVID happened, strokes are not going to stop. Heart attacks are not going to stop. They're just going to continue to happen, and there are still emergency diseases. So it is very important that you seek emergency care in this kind of situation. So I just want to end with the message that we're here for you, and if you have any signs and symptoms that you think you need care, our tele hotline, I mentioned here. And if you think you have any emergency, just like I mentioned, just because we have COVID prevalence, the non-COVID morbidity and mortality is not going to stop. And if you need emergency care, we have this 24/7 emergency hotline number, which you can contact. So please continue to stay strong, stay safe, and I believe together we can overcome this. So with this, I would like to conclude. Thank you.
Thank you so much, Dr. Thiri. It was really informative and it was much required, because everybody was like, when to approach the doctor, what are the facilities available. I think you have covered most of the questions. However, there are some questions I received in the comment box, which I'll ask you, which I'll forward you once we're done with the Dr. Gershu Paul's session. So at the end, we'll start with one more question answer session. So thanks a lot for joining us. Thank you, Dr. Thiri.
Thank you.
So I would like to, thank you. I would like to inform everybody that Punline Hospital have started the telephonic consultation, and the number is 01368 4323. I'll repeat, 01368 4323 is the number for telephonic consultation. Further, in case of any emergency, 24/7 number is 0136844111. I'll repeat 0136844111 is an emergency number. So with this, we'll move on to the last session of the evening. After that, we'll start with the question and answer session. I have noted down many of the questions in the comment box. Now we have with us Dr. Gershu Paul, who is the Chief Executive Officer of Hlaing Siloam Group of Hospitals. Dr. Gershu is a Sri Lankan citizen, Sri Lankan by birth and New Zealand citizen, and he has over 33 years of experience in the international healthcare. His expertise in healthcare service planning, population-based funding models, strategy development and execution, project management, turnaround management, and clinical operations. He received his MBBS degree from Bangalore in the year 1986, so he has connect with India. And then after, he did his Masters of Business Administration from University of Otago, New Zealand in the year 1996. In addition, Dr. Gershu graduated in 2016 as a Fellow of the Royal Australian Medical College of Administration, Melbourne, Australia. Prior to joining Hlaing Hospital in 2014, Dr. Gershu held the senior executive position in Sri Lanka, New Zealand, and Indonesia. He was the Director of Administration at Thorn Group of Private Limited from 1989 to 1992. After completing his MBA in 1996, Dr. Gershu joined Southland District Health Board as a business analyst and rose to become as a Chief Executive Officer in the year 2001. So Dr. Gershu joined Hlaing Hospital in 2014, and after that, he has turned around the private healthcare sector in Myanmar. He was instrumental in taking the 4 hospital group to 29 hospital groups and successfully listed on the Jakarta Stock Exchange in the September 2013 at a market capital of $1.8 billion US. So in 2014, he joined Hlaing Group. In the December 2015, the hospital opened the first medical tower in the downtown Yangon. In addition, plan was solidified for 10 hospital expansions. In the year 2017, the second 75-bed, around $12 million hospital in Mandalay was opened, followed by the successful $9 million acquisition of 140-bedded hospital in Taunji in the year 2018. In 2020, Hlaing Siloam Hospital have launched the emerging healthcare vertical and also opened its second medical tower in north of Yangon. So Dr. Gershu has a healthcare experience as well as overall management experience of hospital. So he's the right person, and we are really happy to have such an eminent guest who has worked in the healthcare sector as well as known to the corporates of hospital. So sir, over to you. The session is yours now. And I have few questions for you that you can cover during your lecture. Dear sir, you have on advisory panel of Kamboja Bank, CB Bank. The question is to you that what will be the business impact and perspective, especially for the healthcare and pharmaceutical industry in Myanmar? How do you prepare for that one? The second question is, when do you foresee things getting back to normal as it was in the year 2019? Is there any possibility of complete lockdown in Myanmar? How the situation in other ASEAN countries and how they overcome that? And how to manage mental health during this stressful period? So the session is all yours, Dr. Gershu Paul.
Thank you, Dashrath. Feel a bit embarrassed with your introduction because I feel quite old in the years that I put into healthcare over a few countries. But anyway, I'm very glad to be here, and thank you very much for hosting this to the community in Myanmar. And I'm sure, at least I'm sure and I hope that through our discussions and through what we are presenting today, most of the myths or most of the misconceptions that a lot of us seem to have with this COVID-19 pandemic that's around us will at least be put into real perspective. I haven't prepared this presentation because I just thought I'll just speak off the cuff and also respond to the question specifically, because they're all very valid questions. They're very valid questions because one of the biggest challenges that the whole world has been facing is life over livelihood. Do we put life ahead of livelihoods, or do we put livelihood ahead of life? Initially, when it started from Wuhan in December, in fact, ironically, I was actually in China when the first lot of patients were discovered in Wuhan, and I was in Shanghai on the 4th of January when this whole thing broke out from Wuhan, and the country just about started going into lockdown. And at that time, nobody knew what this was. All we knew that it had made what we call the zoonotic leap from the bats. At that time, they were not even sure of that, but it's quite clear. That's why it's got the same name, because the whole corona breed has left from the bat to the human being, and now it's transferred from human being to human being and has become infectious. Now, what's different in this particular virus is that it is highly infective. It's over 7 to 8 times the normal coronavirus that we saw in the SARS or in the epidemic before that, even MERS. But it's also about 14 times more than the normal influenza. So this is one of the biggest challenges. And the other biggest challenge is that it spreads during the pre-symptomatic stage. And now we know after 9 months that there is nearly 40 to 60% of the patients are actually completely asymptomatic. So they didn't even know that they carry the virus. And it's also not necessary that every asymptomatic patient is a carrier. Likewise, every symptomatic patient also may not be a carrier, because it depends on the viral load that that patient has, and also depends on the severity of the disease prevalence in that individual. So there are lots of moving parts in this, and we should not just take one broad brush and say that it applies to everybody. Having said all that, there is a silver lining in this. And this is why, as Dr. Thiri said and Dr. Praveen said, we don't need to panic. Firstly, it's there. It'll remain for the next, I believe, for the next 1 year. We will not find a solution, at least till mid-2021. That's my belief, because of the way that this pandemic has taken across the world, and not only that, also in terms of what's preceded it, the other pandemics. We know that vaccines, natural death is what brings about the demise of a pandemic. If you go back to 1919 and you look at the Spanish flu, it affected nearly 1 billion people, killed over 100 million people. There was no technology like we have today. Of course, there was no travel. The only travel was on steamships or on camel black. But it went across the world, right across the world. And it took 3.5 years before it had a natural death and never resurfaced other than a normal influenza. So the most important message I want to give everybody is that this is around us, and we need to learn to coexist. We need to learn to coexist, and we need to get some simple, basic things right. And Dr. Praveen highlighted it. Number 1, this personal hygiene. Number 2, social distancing. Create your own bubble and stick to that bubble as much as possible. And number 3, wear a mask if you are in a public setting. Number 4, don't get into closed areas, and in crowded areas. The highest rate of infection, and I'm not sure whether any of you know this, is not in congregations, not in meeting rooms. It's actually in your family home. When family and friends visit home, and a number of people get together, and you have a dinner or have a drink, that's when the spread really occurs, and that keeps going from one family to the other. Of course, there are super spreader events, like we see what the President of the United States is doing in closed circuit, in closed halls. He has a big convention, and that's a super spreader event. And the other biggest super spreader event is where you have musical shows in closed opera houses. So that's why all the Broadway shows and all those shows have been closed down indefinitely. Now, if you look at the disease pattern, it's very clear that 50% of the disease prevalence is in the Americas, consisting of United States, Brazil, Mexico, Chile, Paraguay, and Uruguay. The balance, about 33%, 34% come from where we are, the Asian continent, of which India is the largest contributor, clocking around 75 to 95,000 a day now over the last 2-3 weeks. And very soon it will overtake USA, which is at about 6.5 million. Predicted to overtake USA around the mid of October. But having said that, what's the difference in India and the US is, in US the mortality rate is 200,000 to 6 million, very high, compared to India where the mortality rate is 70,000. Is it the same virus? Lots of people are doing studies on that. There are more than 300 to 309 types of genomes and genetic mutations. But what is good again, which is good news, is while the transmissibility has increased over time in the last 9 months, the virulence has dropped. And this is depicted classically in the mortality. Dr. Praveen talked about the mortality. Dr. Thiri spoke about it. Only 1 to 2% go into intensive care. And of that, only about 1.5% to 1.7% have some sort of mortality if you go into ventilation. 80%, 80 to 85% do not show any signs and symptoms. And about 5 to 10, 15% may get into an hospital, may need only basic oxygen. Around 5% of that 50% of that 15% may require some further intervention, and only about 2 to 3% need ventilation. So it is a manageable disease. It is a disease that we have to coexist with. At the moment, again, Dr. Praveen highlighted, there is no therapy, there is no treatment. There is a combination of convalescent and a prophylactic therapies that help you to overcome, along with your immune system, to fight the disease and survive. The only way it will be eroded is 2 things. 1, a combination of natural death, and 2, a vaccine. We also know that the vaccine, there are more than 249 vaccines in different parts of the world, but of that about 23 are advanced considerably, and about 3, the AstraZeneca, the Moderna, and the Pfizer and Johnson Johnson, these 4, along with Oxford University, particularly AstraZeneca, they are the ones that are way ahead of the pack, and probably due for release around, I don't believe it will be before March, April of 2021. Now, let me put that into perspective. You know, the last time the vaccine was created was for anything. When you look at chickenpox, SARS, measles, for SARS, it took 10 years. 2009 was SARS, and 2018 was when the vaccine really came about. The normal cycle of a life cycle vaccine is about 10 to 12, 13, 14 years. And today, due to technology, advancement, genetic studies, genome proliferation, we are able to get the vaccine in probably 12 to 18 months. So that's a quantum leap of science and knowledge. So, so I really wanted to share that, and I wanted to really convey the message that do not panic. We will have to coexist. In the ASEAN region, all our countries, if you look at Indonesia, if you look at India, if you look at Myanmar now, and if you look at Pakistan, Bangladesh, Philippines, all these countries are on an upward surge. In fact, even Europe is on the 3rd phase. As far as I'm concerned, I share with my team that, really speaking, Myanmar is actually in its 1st cycle. Because the 1st cycle lasted from about 23rd of March for about 4 or 5 weeks, and then it just plateaued at about 275. So it took about 165 days to get to the first 1,000. It took another 2 weeks to get to the second 1,000. It took about 8 days, 7 days to get to the third 1,000, 4 days to get to the 4,000, and only 3 days, in fact 2 days, 2.5 days to get to the last 5,000. So this is where we are. So I'm very happy to, I know that time is running out. That's why I didn't have a deliberate presentation, Dashrat. But I want to also wake people, really, I want to highlight one thing. If I can get one message across to everybody in this forum today, is yes, COVID is around us. Remember that, as Dr. Thiri said, if you feel that you have the signs and symptoms and you're well and you can manage, given all the circumstances that we have, wherever in the world you are, best option is to stay at home and let the signs and symptoms pass so that you don't infect anybody else. You ring fence yourself in your own home and then you self-isolate. Of course, if you need care, then you need to seek the appropriate care from the appropriate authorities. But if you, the more important thing is what I call the third and the fourth wave. Now, this third and fourth wave is an unseen wave that is about to hit us very soon. And that is typically seen in the business that we, healthcare. Every hospital in the world, wherever COVID has come in the first 6 to 9 months, has really lost their volumes considerably due to a number of reasons of patients being scared, patients not wanting to come in because of the COVID. For all those, the real need that they have for their cardiac or diabetic or obesity or lung disease or asthma, they don't come. So they keep avoiding that, but the inevitable hits. And this is when the third wave will come. And Dr. Thiri showed that graph where all the studies are very clearly showing that the morbidity and mortality due to that will be far higher than the morbidity and mortality of COVID. That's the end result. That's a fait accompli that we are facing down the road. And here's the fourth wave. The fourth wave is because of all the economic depression, all the social fragmentation that this pandemic has brought about across the world. I'm sure you all know, in India, we've lost about 120 million people have lost jobs. In US, nearly 65 million. In Europe, nearly 45 million. And I can go on and on and on. And every GDP has lost double digit, contracted double digit. New Zealand has just become, for the first time in 12 years, it's gone into recession. Now, what this will do is it will bring drastically the psychic trauma, the mental illness, the economic injury, and the burnout will be a long tail, which will carry on for the next 2, 3, 4 years, foreseeable 2, 3, 4 years, unless we are attentive to it and really support and make sure that we adjust. So Dashar, I want to stop there. I'll just take those questions very quickly. And then, because I know that we are running out of time. So if you're okay, I'll just take those questions very quickly to see what I've answered or what I haven't.
Oh, sure, sir. We can go with your questions, no problem. We have a time, there is no restriction on time, we can go on.
Yeah, so the questions were, firstly, for me, you asked, what do you think the impact on healthcare and pharmaceutical industry in Myanmar? I think not only in Myanmar, all over the world, healthcare has had a significant impact, largely not because of the demand loss, but largely because of the perception and the stress and the worry around it that people do not come into healthcare. So when I look at my colleagues from India, from US, from Indonesia, Philippines, Australia, all the hospitals have lost about 40 to 60 to up to even 80%. In fact, in the US, they're supporting around 20,000 hospitals, small hospitals, rural hospitals, because all the electives were cut. Now, look at the elective waiting list in Australia. It's about 1 year. Elective waiting list in Europe is about 18 months. So all these have been pushed out. Not that they're going to vanish. The inevitable is going to happen. So while healthcare has taken a dip now, and this tail will depend on how long this whole pandemic lasts around us, there's no doubt that healthcare will take probably a U or even a sharp V turn. Now, how long that will be, in my prediction, will be another 6 to 9 months. And we will see that U and V coming up through the healthcare. Of course, pharmaceuticals is linked to healthcare. And therefore, when that uptake happens, the pharmaceutical uptake will also happen. Having said that, the pharmaceutical industry will not suffer as much as healthcare because there is lots of different combinations of drugs and therapeutics that is required to treat with COVID. And people will then also self-medicate. So that's on the healthcare. When will things come back to normal? I said that in my earlier spiel. I think it'll be around, I don't know whether we'll ever get back to normal. I think we'll have to live with this new way, whatever that new normal is. But it's good for society because we'll be more mindful and more hygienic. But I sincerely believe that end of next year, this will just be another influenza. And we will have a vaccine. We'll take it. It'll be a duopoly vaccine, which is a double dose vaccine. And unfortunately, nearly 80% of the vaccines have been bought by 14% of the population, the richest ones in the world other than China. So that's another challenge we'll have to face. Luckily, India is safe because the largest vaccine producer in the world, Serum Institute, is in India. So Indians can be sure of the vaccine, but people, Myanmar, will have to struggle to get the vaccine. When do you foresee, is there a possibility of complete lockdown in Myanmar? Well, I mean, I don't think so. I really don't think so, just like India, because the argument is life versus livelihood. Having said that, I think there may be something sort of a circuit breaker. I believe that the Myanmar government should put a circuit breaker, at least for 3 to 4 weeks, so that we can get some, space and create a break in the cycle of the spread. Because you got to remember, the only way that you can cut this spread is to starve the virus of its next human. Because as soon as it goes from one human to the other, it starts multiplying. So the only way to cut it is you exhaust it by ring fencing it and isolating. So yes, I believe there will be, I don't think there'll be a big lockdown, but there definitely will be a partial lockdown. Other Asian countries, ASEAN countries, I spoke to you about that, Philippines, Indonesia in the main, they are running at about, Philippines is running at about 4,500 a day, and Indonesia is running at about 5,000. Still, the mortality is not as high as the Western world. Now, that is largely because, as you and I all know, the ASEAN region, we have a huge bubble in the middle and the low middle population in terms of age, whereas the Western countries have a high old age population, and nearly 60 to 70% of the deaths were over 60, and those who had underlying conditions or were obese. Do you think flu and it'll live and we will live like it? Definitely. What impact will it have on the overall economy? I mean, the global GDP is contracted by about 13%, I believe. We will see a net negative growth of about 6 to 7%. Literally every country, India was about, last quarter was about 23%, minus 23% contraction. So that is going to go on for about, but then this is the best time to put your money on stocks. Everywhere in the world, the paradox is stocks are going up, largely because driven by technology companies and of course, a lot of the vaccine and genetic companies. So that's where the overall economy, I mean, this tail, I believe, will be much longer than the GFC of 2009. GFC of 2009 took about 7 to 8 years. This tail will last more than a decade. Which sectors will recover faster and which sectors will have maximum impact? I think the sectors that will recover fastest is the healthcare. Of course, the local food and beverages and hospitality, that will all come back very quickly. Local domestic travel will come back quickly. But overseas travel, hotels, and tourism will take at least 2 to 3 years to come back. So I want to stop at that, Darshan, because any other questions for the panel, I'm very happy to take. But I hope that was informative.
Absolutely, sir. I mean, as you said that you feel old, but actually the knowledge you have and you covered the crux of the presentation. What was our agenda is to make people realize this virus will be there with us for a long period of time. We have to live with it, and we have to approach our life, new normal, positively. I think you covered all the aspects, right from commercial aspect as well as healthcare aspect, and you have given a brief to the people that, okay, don't expect anything immediately. We have to stay with this. The only thing is in our hand that we have to cut this chain, we have to break this chain. That's the only solution we have at this moment. Don't go with the fake promises of vaccines and everything. That will take time. Even if it come early, it's a bonus or it's a bonanza for us. I mean, it's a blessing for us from the God, we can say, if it comes early. So that was the presentation, and our objective was same, that people are panicked. Let's give them authentic, credible information. As we rightly mentioned at the beginning, that due to evolution of social media, everybody is accessible to any information. So people most of the time miss that which is the credible one and which is the fake news. So that was the objective to call the people from healthcare segment who are dealing with the patients, who have the experience of overseas hospitals and healthcare system that you covered, Dr. Thiri covered about the local protocols, Dr. Praveen covered about the medical aspect of the COVID, that sums up a complete session. thank you all three of you. And we move to the question answer session. And some of the questions we received, I just pass the questions to the respective speaker. So, Dr. Praveen, can I have Dr. Praveen on screen?
Dr. Praveen, you.
Yeah.
Yeah. So there's one question that how severe COVID-19 will affect a patient having hypothyroidism, and what precautions will be taken care of?
Hypothyroidism has not been studied as a risk for the COVID much, but still, because mainly it is affecting the old age patient, the same risk as that of diabetes, but less as compared to the diabetes and cardiovascular disease. So they need to take the same precautions. Not much worried that hypothyroidism is not mentioned in a major risk factor for the COVID-19 as diabetes and heart.
जिन्होंने भी सवाल पूछा है आंसर ये है कि हाइपोथायराइडिज्म के ऊपर ज्यादा स्टडी नहीं है लेकिन आपको प्रिकॉशन लेनी है बट डायबिटीज
Sir, we cannot hear you.
Oh, sorry, just a second. Can you hear me now?
Yeah.
तो द क्वेश्चन आंसर इज वेरी सिंपल. हाइपोथायराइडिज्म में कोई ज्यादा स्टडी नहीं है बट आपको प्रिकॉशंस लेनी है. इट इज नॉट एज डेंजरस एज कार्डियक और डायबिटिक थिंग. आपका जो मेडिसिन डॉक्टर ने प्रिस्क्राइब किया और रेगुलर आपको कंटिन्यू करना है. द नेक्स्ट क्वेश्चन टू डॉक्टर प्रवीण इज it was about which vitamins are helpful. I think you have already covered. Vitamin C, D, zinc supplement will be helpful. Am I right, sir?
Yes. Yeah. Vitamin C, D or zinc supplement you can take.
अच्छा, तो मार्केट में whenever you go you will get a OTC. You don't need a prescription. You can buy vitamin C supplement. You can buy vitamin D, Cifrol 60K 60,000 के ब्राउन का आता है. नीरज पांडे जी है, उनसे आप कभी भी कांटेक्ट कर सकते हैं. वो डोसेज भी आपको समझा देंगे. विटामिन सी मार्केट में अवेलेबल है. जिंक के लिए बिकोजिक है, जिंकोविट है, सारे लीडिंग ब्रांड्स हैं. उसके अलावा जो भी आपके बजट में बैठता है आप यू कैन बाय दैट मेडिसिन. इज अवेलेबल फ्री इन मार्केट. Girish Pimple, want to ask you that we understand that there is a more and more asymptomatic cases. So is it happen like initial 7 to 8 days they don't have symptoms, but 8 to 9 days they will develop a symptoms and they will be severely affected?
See, there are two criteria. ऐसा गिरीश पिंपले जी, it is like that 50 to 60% लोगों में symptoms दिखेंगे ही नहीं. उनको पता भी नहीं चलेगा there was a corona or not. So this will happen. But in some patients which are 40%, उनमें they will show the symptoms. What they will show the symptoms? It will be after the 5 days after the exposure. है ना, जिनमें symptoms दिखेगा उनको 5 दिन बाद में दिखेगा. जो भी mild cough हो, सोर थ्रोट हो या सांस फूलना हो, ये 5 दिन के बाद दिखेगा. जो 40% रिमेनिंग है, जो 50 to 60% है, उनमें कोई भी सिम्टम्स नहीं दिखेगा. इफ सपोज किसी को हो गया उसको पता भी नहीं चलेगा. दैट इज अ फैक्ट. एंड एज डॉक्टर गर्शु सेड, ओनली 10% लोगों में हॉस्पिटल में एडमिट होना पड़ेगा और 5% लोगों को आईसीयू में जाना पड़ेगा. तो मतलब इट इज वेरी लेस. सो 50 to 60% असिम्टोमेटिक, वो भी डायबिटीज हो, हाइपरटेंशन हो, उनमें भी हो सकता है, वो भी असिम्टोमेटिक हो सकते हैं. और जो 40% सिम्टोमेटिक है वो इस रेंज में वेरी करेंगे. और वो जो सिम्टम्स है एक्सपोजर के 6 दिन के बाद, क्योंकि उसको इंक्यूबेशन पीरियड कहते हैं ना, वायरस को पूरा डेवलप्ड होने में, उसके बाद ही सिम्टम्स. आई होप दिस इज क्लियर.
Perfect answer है. इतना then we have a question from Mr. Vatsal Lilani. He wants to ask you, is there any Ayurvedic item which is recommended for boosting my immunity?
देखिए, आयुर्वेद जैसा ऐसा कुछ स्टडीज नहीं है, है ना. मतलब जो भी है, अश्वगंधा है और च्यवनप्राश है, दैट इज नेचुरली प्रूवन कि इम्यूनिटी बढ़ाता है, वो ले सकता है. ऐसा कोई कॉन्ट्रा इंडिकेशन नहीं है. मगर लहसुन और अदरक है, ऐसा कुछ इसमें स्टडी नहीं दैट इज मोर बेनिफिशियल. समटाइम्स पीपल विल गॉट मोर गैस्ट्राइटिस अगर वो बहुत लहसुन और ये खाएंगे, ज्यादा मसाला खाएंगे. सो बेटर स्टिक टू द नॉर्मल प्लान. सो व्हाटएवर इज रिकमेंडेड. ठीक है, च्यवनप्राश ये ले सकते हैं, मगर ऐसा कुछ स्पेसिफिक इज नॉट देयर दैट कैन हील, ट्रीट और प्रिवेंट कोविड. ओके, सो मेनली आपके 3 मेडिसिन जो मैंने बताए हैं, मास्क, सोशल डिस्टेंसिंग, सोशल हाइजीन एंड क्लोज बबल. So that will be the best way to treat the COVID. Best medicine.
Okay. Yeah. The next question is from Mr. Abhijit. He wants to ask you that as you said that most of the patients are asymptomatic, but if I'm a cardiac or diabetic or any underlying condition I have, so will I be asymptomatic or surely I'll get a symptom?
See, the symptoms basically depend upon the role of the amount of virus you are exposed. Understand? So therefore, so if you are really exposed to the infective patient and the viral load is more, then high chances that you will be more symptomatic. Therefore, we are recommending mask as a vaccine. Why? Because sometimes mask reduces the virus load. So there are less chances of getting more severe disease. So that is what therefore the mask is recommended. So mask as a vaccine is a very important statement. And one more thing that nobody can predict. Yeah, we know that above 60, diabetes, hypertension are at the high risk. But below 60, 1%, nobody can predict who will be severe, who will be not be severe. That is unpredictable. Okay. But most of the young people are asymptomatic, healthy carriers. Okay. And old people are symptomatic.
Oh. The next question is from Ms. Poonam. Any healthy food suggestions which are very less in potassium or for diabetes, especially COVID for vegetarian people? Less in potassium for diabetes, vegetarian option.
Less in potassium means you can avoid the banana and potato. These are to be avoided. Other things you can take because potato and banana and sun-kissed fish have the high level of potassium. But you can use malakadi means Peru and papaya are the good options we can use. Okay. And other green vegetables are as usual, no problem. You can take in a vegetarian. And also the sprouts are also okay. But potato and banana in some case has a high level of potassium and also the coconut water. Okay. So please avoid this if the people are worried about the potassium and the diabetes.
Correct. That's great. The next question, the final question for you is from Reflection International. Does COVID spread from the newspapers or any daily milkman is there, drinking water person is there, is coming and handing over to you?
See, many studies, there are sporadic cases, but it is not totally that it will spread from because the COVID virus will not multiply on the surface of the dirt like a newspaper or any parcel is coming. But it is always better to wash your hand after picking up that or clean or spray something on that. Take precautions or sometimes you can keep it for 6 hours in the sunlight or something. It is the virus load exposure will be less, but you should always take the precautions from the newspaper or whatever the groceries you bring from the hand. You should wash your hands before doing other things. Therefore, we recommend you the frequent hand wash. When you touch the groceries, okay, you keep it, okay, but after that, wash the hands. I mean to say virus load exposure will be less. I'm not denying that it can be spread by the newspaper or the other groceries. The virus can survive on that surface. So you need to take frequent hand washing if you are bringing something from outside.
Oh, so these are the questions for you, Dr. Praveen. Thank you so much. Again, to all the viewers, Dr. Praveen is from India. He can speak Hindi, English, Marathi and Telugu. Basically, जब भी हम डॉक्टर के पास जाते हैं, patient counseling बहुत मैटर करता है. उसमें language plays a very important role. So if you have any cardiac, diabetic or any general issues, you can consult to Dr. Praveen. He is available in Downtown Clinic on Tuesdays and Thursdays, as well as you can call to the online help desk, and he is available for the teleconsultation as well. So thank you, Dr. Praveen, for all your support.
Thank you. Thank you. Yeah.
Thank you.
And the next question, can I have Dr. Thiri Aung on line, please?
Hello.
Yeah. Hello, Dr. Thiri. Dr. Thiri, there are a few questions for you. One of my Gopal Chetri, he wants to say that one of his room partner found positive and he was discharged from the hospital after 2 negative tests 1 week ago. So what he was already quarantined in government facilities. Now he's back to home. So what precaution he himself has to take care and what precaution his roommates need to take?
The best is not to stay in the same room, and then when you're in the common area, stay at least 1 meter apart from each other. And then it's possible you have to separate bathroom and restroom, and then use separate utensils like spoons and cups that you use. It's best to use separate utensils, and then please do not accept any guests in the house, and then please do not go out of the house, and then like Dr. Praveen said, wash your hands often. And then when you cough, when you cough or sneeze, please cover. And then if you, it's better to stay isolated, but if you have to talk with your family members, please stay away and then use the surgical mask, cover with the surgical mask, and then stay away from each other. And then it's best, as I said, to self-monitor, like take your temperature and then monitor yourself whether you still have the fever and the cough or any other symptoms. If you don't have that over 7 days, I think it's safe.
Oh, that's great. The next question, I think it's already answered, but again, I'll just briefly put it to you. How does we control the spread with daily milkman, drinking water? Dr. Praveen already answered that we need to sanitize that one. So I'll move on to the next question. Mr. Himanshu Biswal wants to ask you that, is there any private laboratory which tests the COVID-19? And moreover, are there any rapid test facilities in Myanmar?
As of today, there's nothing, no private hospital or facilities doing for COVID tests yet. But then government is considering that option, and I'm sure it will be available soon. And there are some private companies who are already exploring that option. So I think it will be available soon. But as of now, no.
As of now, oh no. Okay. So can we? Next question is from Mr. Dinesh Kapoor. He wants to ask you: can we continue morning or evening walks because it's healthy? I mean, they may be diabetic or cardiac patient. They want to continue. Is it recommended?
Yeah, because like Dr. Robin mentioned before, it's important to keep yourself healthy and do exercise and all that. So it's okay as long as you walk in an open space with not many people. But then usually when people walk in the mornings or evening, they stop and talk to each other for a long time, but stop doing that. Apart from that, walking is okay as long as you're in the open space and you're not close to any other people.
Oh, so I'll sum up that, like, you can go for morning and evening walk with a 1 to 2 meter distance from each other, empty spaces. Go for morning walk, but avoid gossips. That's what we say. All right. Okay.
Exactly. That's on point.
Okay. The next question is from Mr. Kalyan Patnaik. He wants to ask you that what is the protocol flow chart if I feel the symptoms as a foreigner, and related to that, a few questions. How much duration I need to be quarantined when my samples are taken? So this is a combined question I would like to ask.
When your samples are taken, if you are swab negative and if you don't have any symptoms, you can, as of the protocol that is recently came out on 20th of September, you can do home quarantine for 7 days. But if you're positive, of course, you have to be admitted to the hospitals. But then now the government also consider the non-COVID morbidity and mortality, like I mentioned before. So if you are negative with the symptoms, but you have any other comorbidity and other health conditions, you might have to stay in the hospitals longer so that you are continue to be monitored.
All right. So just I would like to share one of the experience. One of my friends' son had a fever, so he had to go for the COVID test, and for that 2 days he was in government's isolation ward. No private hospital, no hotel quarantine were allowed. So I think, am I right in that case, right?
Yes,
you have to stay in a government isolation ward.
Yes, yes. Only when you're tested positive, you might be admitted to the hospital.
Okay, okay. Ma'am, there are many questions. I mean, your topic was related to, I got around more than 5-10 questions. I'll just quickly ask you one more time. That for expats, do they have a separate quarantine facilities or separate treatment options?
No. It's the same. It's the same for everyone.
It's same for everyone. Okay. So, what are the fever clinics and what is their role, and how foreigners are connected to the fever clinic? What exactly role fever clinics play?
Fever clinics serve as the first line of screening. So instead of going to the hospitals, if you go to the fever clinic, the health workers there will screen whether you have a real COVID-like symptoms. And if you're really suspected, they will refer you. If you're not suspected, they will send you for home or to stay in isolation at home. So there's serve as a first line of defense and first line of screening.
Okay. So, ma'am, as a foreigner, if I have a symptom and if I am tested positive, so can you tell me stepwise how they will, what is the protocol, where I'll be taken first, what the treatment option, then when I'll be released, what will happen to my family? Let's say I'm a positive now, so they will take me to government hospital. What will happen to my family? How many days they'll be hotel quarantine, home quarantine, or they will be sent to government isolation ward?
First is there are two parts. So if you have symptoms and you will be and you are really suspect, you will be admitted as a patient under investigations. So and they will take swab tests, and then at that time, from this point, your family has to stay at home. And then, but then if unluckily the swab test come positive, the families will asked to be staying in the facility quarantine. And then if the swab test becomes negative, it's the same protocol as I mentioned before. You may be asked to discharge if you don't have any other comorbidities, or you may be asked to stay in the hospitals if you have any other health conditions or comorbidities.
So if I understand correctly, if I have symptoms, they'll take my swab for the test. Till then, I have to be in isolation ward. If my result comes positive, my family has to stay home quarantine, facility quarantine. Then they will also be tested.
Yes.
They'll be tested.
Yes, as a
and
primary
result
contact.
okay, fine. So which are the places in Yangon which have a COVID treatment options? Like we have a Yangon General Hospital, we have a South Oklahoma, we have a North Oklahoma hospitals. Can you just name a few so that if anybody is suspect, they can approach them?
Mainly in Yangon is the Yangon General Hospitals, the Ding Anzheng Hospitals, Alpaka Hospitals, Hlaing General Hospitals. Yeah, there are 4 major hospitals that we do testing and treatment in Yangon.
Okay, so I think almost all the government hospitals have the COVID treatment wards.
Yes.
Okay, and how soon you expect government to allow the private hospitals to treat the patient with the mild or moderate symptoms? Is there any discussion going on with the health ministry for this one? Are they positive about that?
As Myanmar Private Hospital Association has been ongoing discussions with the government and the public side on how we can make this happen, because this is not a simple issue, because we will have a model. We will need to have the models. We will need to have a proper resource settings and how we are going to separate COVID patients and non-COVID patients in the facilities. So there are a lot of modelings that we need to do. So it's still in discussion, and it's difficult to predict how soon that will be implemented.
Okay, so you are in a discussion and there is no concrete answer at this moment that will the government allow or when they will allow it?
Yeah, because the government's already agreed in principle that they will allow, but how that will happen is a big question, and then that has a great impact on how the implementation will fall out.
Okay. The one more question we have, that if I don't have a symptoms but still my test is positive, will they allow me to home quarantine or hotel quarantine if I don't have symptoms?
You don't have symptoms but you're positive, then
yes.
you'll definitely get treated in the hospital.
Hospital only. They will not allow me to hotel quarantine or home quarantine. Okay.
If you're positive, no, they will take another swab.
Okay. No.
Actually, Gershu, just to answer that question to you, my sincere advice to all those who are on this call, and this is I don't know whether I might be taken and put in jail, but I'm going to just say it anyway. If you can manage your symptoms, and if you take responsibility, and you create your own bubble, and you don't need medical intervention, stay at home till it passes. There is absolutely no worry at all. Whether it's in UK, whether it's in Australia, whether it's in New Zealand, whether it's in US, I mean, all they say is if you're positive, or don't even bother to find out whether you're positive. Because if you have symptoms or mild symptoms, and you know that you are well under control, your breathing is not compromised, and you're well, you know that don't get anybody into your house. Be a responsible citizen. That's most important. Be a very responsible citizen so that you don't inflict anybody else. With your own family, stay at home. That's my real sincere advice, particularly in this part of the world.
Okay, that's great. That's great. Yes, sir. Got your point. And I think most of the questions have been answered by Dr. Thiri. Thank you so much. Dr. Gershu, I have one question for you. Of course, I mean, I like your presentation, of course, talk rather than presentation. You give a very positive message. One last question to you, sir. How to manage my mental health? Because I open WhatsApp, I see many messages. Stay safe, take care. Its situation is dangerous. When I open Facebook, I see hundreds of Facebook lives. People are saying, stay home, stay safe, be strict. Government notifications are coming every day. It has affected my mental health. How do I take care of this one?
Yeah, rule number one, stay in isolation from social media. To be honest, because there is so much of information that's going around, and all that information it becomes a real confusion to the mind and to everybody around you, and you really don't know to separate the right from facts from the myths. So if you really want to know about the disease, I'll recommend a few places where you can keep on your browser, which is what I do. So I know very clearly where to go and look at and get updates. For example, the New Zealand Herald or the Sydney Morning Herald, the newspaper, is a very good newspaper because it's small, it's well written, it's well researched, and the articles coming out are coming from either the CDC in New Zealand, Australia, or from the Australian National University. So they are very, very robust and very dependable. The other one is the New York Times, which is not bad at all in COVID. It's only $1 a month. You subscribe for it, $12 a year. Absolutely brilliant site because it actually provides you all the details and links. And the fourth site is Johns Hopkins. It's a brilliant site. Of course, the WHO site is very good, but it's a bit outdated because it collects all the information and it's about 48 hours lag. But the Johns Hopkins site is a very good site. Again, gives you all the information and lets you know what you should do and what you should not do. But you're absolutely right. The biggest, as I said to you earlier in my presentation, the biggest lag that will take a long time to heal is the economic and mental instability that will be in everyone's life. So my advice, cut off all the crap, cut off all the sound, identify 2-3 locations that you're comfortable with. Don't listen to people that say, do this, do that, do all the soothsayers. Just follow normal, because what we know is there is no treatment. What we know is that 90%, 85-90% don't need any care. They can stay at home and recuperate. What we know is that you should, take the right, be sensible, practice the right things. Just follow those. Keep it simple.
We are done with the question answer session, and we'll just have I would like to say thanks a lot, Panla Siloam Group of Hospital, Dr. Gershu, Dr. Thiri Aung, Dr. Praveen. Just to sum up the session, Dr. Praveen has rightly said that there is no treatment option. You don't expect vaccine too soon. Just everything is in your hand. Stay protected yourself. Mask reduces the viral load. So mask, sanitization, social distancing, these are the 3 things. Dr. Thiri has rightly said that there is no separate treatment option for the foreigners. You will be treated as a normal citizen. You have to go to the government facilities. You have to stay in the government hospital beds for 2 days till your report comes. Once you are positive, you will be shifted to the COVID treatment ward, which are available only at government hospital. No private hospital, no private lab will test you or they will admit you. Fever clinics are there, you can approach them if needed. You can keep the basic medicine at your place, paracetamol, cetirizine, multivitamin like vitamin C, zinc is there, vitamin D is there. And Ayurveda, somebody asked me the question, answer was Chawanprash, Avla, they don't have any side effects, there is no harm in taking that. And Dr. Gershu, the crux, he covered that. Be positive. We have to stay with the COVID. It is not gonna get over soon. It take 2 years, 3 years. We don't know how much time it will take to go back to what we used to live in 2019. It may take 2 years, 3 years. The most affected sector will be hotel industry, tourism industry, airlines, The first covered industry will be food, beverages, and the healthcare segment will cover fast. So this was the entire presentation all about. डरना नहीं है, पैनिक नहीं लेना है. जितना आप डरोगे उतना आप, it is a science. अगर आप जितना नेगेटिव हो गए, पैनिक हो गए, आपका इम्यूनिटी उतना डाउन होगा. When you are panic, your immunity goes down, then you have a more chances of getting infected. There are many asymptomatic patients, which shows that Dr. Gershu has rightly mentioned कि पहले first wave में virus was dangerous. With the time, the virulence factor, the ability of virus to cause the harm to the patient has gone down. Third wave, it will again go down, but it is more contagious than the previous one. That's what Dr. Gershu has said. So I think all the questions are covered. Once again, thank you so much, Hlaing Siloam Hospital, all the eminent speaker and all the audience. Thank you so much for joining. I would like to thank Hemant, Swapnil, who are at the back end and handling all the technical presentations and technical coordination. Thank you so much, guys, for joining us. And thank you, Team Morya, again to come up with some unique, which is needed by the people. So I say, Morya cares. We are available. Dr. Praveen is available. Hlaing is available to help us, guide us. Good night. Thank you so much for joining us.
Thank you. Stay safe.
Stay safe. Good night.
Right.
Bye.